This is Kelly Lee Whiteside, who's a practitioner of Oriental medicine, which also includes acupuncture. Kelly Lee, can you tell us a little bit about acupuncture in particular?
Acupuncture is an ancient form of medicine from Asia about 5,000 years ago, and it's all about the natural flow of blood and energy through our body and how it needs to circulate nice and smoothly through our body that allows us to function, anywhere from being able to sneeze, to breathe, to digest, to even have babies.
What are some of the misconceptions that people have from acupuncture in particular?
I think people are afraid because they're needles that they might hurt, and it does not. They're not the same needles that you would use in a standard doctor's office. They are hair thin, you barely feel them, but yet the power of those needles to stimulate acupuncture points is very powerful. Oriental medicine is like an umbrella name for a lot of different modalities, acupuncture probably being the most common and widely recognized, but it also encompasses other modalities like Chinese herbal therapy, cupping, gua sha, moxa, and so forth.
I don't really know what any of those things are, but let's stick to acupuncture specifically for pain relief. Most people have neck or back pain, so how does acupuncture fit into that picture?
Acupuncture works great for pain, and actually neck and back pain is probably so common. Doesn't matter what someone's ailing from, they usually come in and always complain about some additional pain like neck and back. Acupuncture works with pain because it helps to relieve some of that stagnant blood and energy that causes pain. Similar to when you bump your knee and you get a bruise on your knee. The whole time you see the bruise, you can see that physical stagnation of blood and energy. And so the whole time you can see that, the bruise is quite tender, really painful. And when it starts to dissipate or go away, the pain is gone. So the same concept anywhere in the body, whether there was an accident or a trauma, that's stagnant energy and blood. And acupuncture works with our needles and sometimes herbal therapy in order to move that stagnant energy and thereby relieving pain.
Now, we talked about needles. That's definitely something I know with acupuncture. So how many needles? How big are the needles? I'm afraid of the needles. Tell me about the needles.
Sometimes we get patients that come in that are quite nervous about needles. I used to be afraid of needles as a child, but it is nothing. Needles are not the same as used in a traditional doctor's office. Acupuncture needles are as thin as a piece of your hair. Very flexible, very, very thin. Most patients don't even feel the needles. The needles are used to really just move stagnant energy, or they're used to help nourish, tonify, or strengthen certain areas of the body.
How does acupuncture fit into the whole picture of medicine when you're working with traditional doctors?
Acupuncture is a great complement. A lot of times patients come in, they might have, sore back, sore neck, but that's not the only thing or complaint they have going on. As adults, we're pretty complex, and we usually have a myriad of other internal medicine-related problems. Acupuncture works to address the pain, and people are really surprised. At the same time, it'll relieve their heartburn, it'll improve their digestion, improve their sleep, even relieve menstrual cramps.
So tell me a little bit how you deal with pain and pain relief in your practice.
Well, I think it depends on how severe it is. I mean, I think sometimes people come in with their own tolerances of pain. You always have to be aware of, do people have different tolerances, and also what does pain mean to somebody. First of all, as a doctor, I have to say, well, what does pain mean to me? Is there something dangerous going on? So if there's something on my part that raises a red flag that there's something serious on, I don't mean pain's not serious by itself, but is there a disease or a nerve injury or something that warrants immediate attention? So do we need to admit someone to the hospital? One of the biggest things with pain, no matter what level it is number one, giving people a sense that they're going to get relief. I think there's people calm down even before they get pain medicine, just knowing they're going to get pain medicine. I think they also want their fear allayed of, does this mean I have something bad? Is something broken? Do I have cancer? People need to know their pain it's possible to stop it. I think if you have uncontrolled pain, people get very panicky. It's hard to tolerate pain, and that is kind of what pain's power is sometimes. A physiatrist, in seeing someone with pain, is going to have a kind of set of options. One of them might be medications to give people relief kind of around the clock. Another one might be, and very often is, something physical, like physical therapy or multiple, the number of physio-type therapies. A third might be using complementary care, in particular acupuncture, which I think is very helpful in a broad range of pain problems and musculoskeletal problems. On my end as a physiatrist, I would be using very specific targeted procedures such as injections, or what are called minimally invasive procedures, to try to help with diagnosis and treatment. And finally, the minority of patients might need surgery, and we would have our surgical partners see the person for that.